I will speak a little bit about what we are doing in the private sector that the health cluster represents, and the partnership that we are creating with the public sector to drive more faster the collection of data and the secondary use of data. So briefly, just to explain the Portuguese health ecosystem. So we have more than 230 hospitals, public and private. We have 12 clinic academic centers, 30 public universities, 60 R&D institutions, and we have more than 90K companies. And since 1975, we have a national health system in place. The cluster is a nonprofit private association, and we have more than 220 members. And our members are from the different parts of the value chain on the healthcare sector. So we have universities, public and private, hospitals, private and public, R&D institutions, companies, from startups, SMEs, and large companies from the all subsectors. So we have biotech companies, medtech, medical devices, equipment, software, any kind of product or service for the healthcare system. And also we work with patient associations. And our members are alongside our country. In health cluster, we have 4 strategic agendas that are managing us for at least 3 years. The first one is innovation. We are very focused also on attracting foreign direct investment and support industrialization in Portugal on healthcare. And these 2 other agendas are very focused on what we are speaking today here, is the digitalization of the ecosystem and the data. So we are working with our members to accelerate the expansion of the digital ecosystem, so creating more products and services, and also working with them to the primary and the secondary use of data for improving healthcare. And having this agenda in mind, we have a big project now that is funded by the Recovery and Resilience Plan. But it's important to say that all the projects that I will present now are projects that we have been working for 3-4 years. Now they are more structured and with a different logic, and of course with a different budget to work. This project have 92 partners from the private and the public sector, mostly from the private, but some from the public, mainly hospitals and R&D institutions on the public. We have a global investment of 94 million and a global incentive of 70 million. And we have all kind of partners here, from companies, patients associations, R&D, hospitals, etc. In 3 years, we hope that we will have more than 90 products on digital area, or services or products. And the interesting part of this project, as you can see here in the image, is that he have 3 vertical projects that have at the center the creation of a national health data lake. And I will explain what each of these projects briefly. So the first one, it's the biggest one, and it's called the SmartHealth. And what we want to do here, and we are starting to do, is to work with public institutions, universities, hospitals, and mainly startups on creation on digital products and services for prevention, diagnosis, treatment of different diseases. And all the data that is collected or will be collected by these smart devices or digital systems will go to the central data lake that we are preparing. And all of this will happen with by strict standards that we are adopting, so we can have all the data standardized, and all the data can be used not only for primary use for providing care, but also to stay on the data lake, and can be used by Portuguese institutions for secondary use, and also for European institutions for secondary use. The second pillar is the value for health. And here in this project, what we are doing is creating an ecosystem and technology for data collection that allows us to create a value-based healthcare ecosystem. So we will collect patient-reported outcomes and clinical reported outcomes and costs, and create and evaluate the kind of care that Portugal is providing, and try to move to a more informed decision on policies when providing care. We also will have here specific tools like artificial intelligence to manage all this data and to help us having conclusions on what should be done on primary care. Also, the data created here will merge to the national data lake. And finally, the third pillar is the clinical trials powerhouse, and the most important objective is to position Portugal as a strategic partner for clinical trials. So we will capacitate hospitals and R&D institutions in Portugal with technology and standards to collect data for clinical trials. And at the same time, they will merge also for the Portuguese data lake. And finally, we are in the middle. We have this, what we call Health Portugal Data Lake. Here we'll have not only the data that comes from the three pillars, but we are still working on the business model, on the legal and on the ethical framework that this data lake should have to be used for his purpose, that is to contribute to the improvement of healthcare epidemiological forecasting, for the development of innovative products and services, and as well for the definition of new models for financing and procurement and payment in health. Of course, that this health data lake it's with Portuguese data, and the infrastructure and structure and the model that is being created, it's aligned with the European health data space model evolution that we are having, in order to be a data lake that can be used by our other countries in the European Union. So briefly, this data lake, and here it's important to say that here we have an important partnership with the public. So for this data lake, besides the three pillars that I speak before, we'll have the hospitals from the public sector contributing with their data to this repository. We'll have pharmacies, we'll have insurance companies, we'll have medical devices companies and laboratories. And so what we can see in this figure is that we can collect different types of data, even payment data, that then can be used for future analysis. So of course, we'll have a quality control criteria. Then we have an infrastructure for analysis, and then user interface for anyone with ethical and all the platform that will be created to make some consultations and analysis on this data lake. Apart with this big project that we think will have a great impact on the data collection, structuration, and sharing within Portugal and with other countries, we have three initiatives that I think it's important to share today, that we are the leader of the Digital Innovation Hub, the European Digital Innovation Hub in Portugal. And with this, DIH will give services for any kind of private or public entity that needs support on developing products and services on the digital health area. This will help those companies that are in those three pillars to leverage their products and services from the R&D to the market. Also, we are part of a TEF health consortium, where we have a space for test and experiment artificial intelligence solutions in real environments with specific conditions. And this will allow us and our ecosystem of private and public partners to test all the solutions that will produce data and standardize data and even evaluate and get intelligence from the data. And finally, to finish, we are also working with ScanBalt and 14 countries in the European Health Data Space Joint Declaration since 2020. And we are now involved in a European project called EHDS. The objective is to promote dialogue and the inclusive involvement of stakeholders in development of the European health data space. And here we are consortium with Spain, Estonia, and Belgium. And here what we want to do is to, besides showcase what we are doing in Portugal and these other countries, and all the countries besides being on the consortium or not, try to ensure that no one gets behind, being a patient, being a startup, being a person, and also to share all that we will learn during these 3-4 years project that I speak about it in the first slides of my presentation.